Well, this morning, doctors and health experts, as we move on to our top story here, reacting after the measles claimed the life of an unvaccinated child who passed away at a hospital near Lubbock.
And while many people are vaccinated against the measles, you should still take extra care with their infants and your young children. Our very own Patty Santos spoke with the Little Spurs pediatric urgent care doctor about the signs that we need to start looking for. Good morning, Patty.
Hey there. Good morning, guys. You know, I have a 4-year-old. I had to call the pediatrician's office yesterday to make sure that he's had that second vaccine. But we are learning so much about the measles, including that it can still impact children who are vaccinated. So kids vaccinated could have a milder episode of the measles, or they might not. But because it's so highly contagious, as soon as you see that the symptoms start, make sure you keep them home and look for things like a fever, a cough, a runny nose, and the key thing is right here: red, watery eyes, maybe even some white spots inside their mouths. The rash that we all know about doesn't show up until the later part of the infection, like 4 to 5 days, but by that time they've already infected others. There's no rapid test to check for the measles, so if your child shows early symptoms, don't rush to the doctor's office. Call them instead first so they can give you instructions on what to do.
Like most viruses, it can give you a pretty high fever, 104, 105. So you treat that with ibuprofen or acetaminophen, lots of fluids, rest, hydration. And if they develop trouble breathing, which is the most common complication and the #1 cause of death in children that are not immunized, then you need to go to the hospital.
And many pediatric clinics like Little Spurs are taking precautions to keep those kids safe. If they suspect the measles in their office, then they're going to ask the patients to wait in their vehicles. The virus can linger in a space for up to 2 hours, so they have to protect other kids who enter their clinics. And also check this out. If you have your child has gotten the first vaccine, they are 93% protected. If they've gotten the second vaccine, that's by 4 or 6 years old, then they are already 97% protected. If your child is not vaccinated with the MMR vaccine and you know right away that they've been exposed to someone with the measles, then a pediatrician can give them a shot after exposure, but it has to be within 3 days of that exposure to make their infections a little milder. After 6 days, it is too late.
This morning, we got a child who has died as a result of the measles outbreak happening in West Texas.
The child, who was reportedly unvaccinated, died at a hospital in the Lubbock area. Now, state health department leaders also say that child was in the hospital for about a week with the virus.
So right now, there are no confirmed cases of measles here in Bexar County. But according to Texas Department of State Health Services, they've been following it. In West Texas, and it's a different story, though. Over 124 cases of measles have been reported across 9 different West Texas counties.
And when it comes to protecting yourself from the virus, doctors say getting vaccinated is the best defense against a highly contagious virus.
Measles is one of those diseases that can be spread through the air. And even just a few particles of measles in the air are enough to infect someone if they don't have protection, and protection would be having received the measles vaccine. So if an unvaccinated person enters a room where someone with measles was even 1 or 2 hours before, there's still a very high likelihood that they would contract measles. That's how contagious it is.
So here's another alarming part. There is no treatment for the measles, and there's also no rapid test to find out right away if someone's been exposed.
So we know it's highly contagious. We went over that, and that is why a lot of our school districts locally have been keeping a close eye on this situation. Some of them, like Northside ISD, sending emails to parents to remind them to keep their children home if they have a fever over 100 degrees.
Patty Santos live right now in the studio with more on what we know about the district's vaccination rates. Of course, Patty, this has been something that you've been working on with, being a mom and also following the numbers and keeping us up to date.
Yeah, that's right. We are looking at vaccination rates for local school districts in Southwest, Harlandale, Alamo Heights have an over 98% vaccination rate. Northeast San Antonio and Judson ISD have about 95% rates. Edgewood and Northside ISDs are at the lower 90th percent rates. Now, the virus can stay in a room for up to 2 hours. So a lot of pediatric offices are taking precautions to see kids outside of their offices. And Little Spurs Pediatric Urgent Care says they are going to be doing telemedicine calls first. When the patients show up, doctors wearing protective gear will meet them in their car and do a swab test. That test might take a few days to show the results, so the child is going to be sent home. Now, there is no cure for the measles. The only time you need to go to the ER is if your child starts wheezing or having breathing problems. Dr. Alicia Tezle with Little Spurs says you need about 95% of the population to be vaccinated so that it can be contained. One infected person can give it to 12 to 18 other people who are not vaccinated.
It suppresses your immune system for up to 3 years after you have had the measles. It can suppress your immune system for up to 3 years. And that means that you will get other infections and even vaccine preventable diseases. If you've gotten a vaccine against chickenpox, you can still be, for the following 3 years, more likely to get it because it just blocks your immune system.
And listen to this. A post-exposure prophylaxis can be given to an unvaccinated person exposed to the measles 72 hours after they have been around someone with the measles. And a second treatment can be given to them before the 6th day. This can modify how the disease impacts that person. So the bottom line is if your child is vaccinated, they can still get a little sick. So you want to keep an eye out on those early signs.